In Kentucky, our story is unique. We are proud,
He is coming home to Kentucky.
generous, hardworking people. Known across the world for our values, our work ethic, and our way of life. Ford Motor Company has been a part of our story since 1913 when, together, we rolled a Model T down an assembly line in Louisville, and later served our country producing Jeeps during World War II. As Ford's roots here in Kentucky have grown strong, so have we. For more than a century, our workers have built vehicles driven around the world, giving people the opportunity to pursue the road ahead. Now, we are writing a new chapter, one for the next generation. With the largest investment and most jobs in our history, together, we are building the largest electric vehicle battery projects in the country. We will power the auto industry of the future. Our already skyrocketing economy is set to climb to new heights. We are ready to build a better Kentucky for all our families. Our future is now. Good afternoon. This week, here on the steps of the Capitol, we celebrated the largest economic development project and announcement in our history. We were joined by Ford's Executive Chair, Bill Ford, CEO, Jim Farley, COO for North America, Lisa Drake, and our brand new incredible partners at SK Innovation, including Dong Sub G, President of SK Innovation's battery business, and so many more. Together, this week, we set out to build what we believe are the largest electric vehicle battery plants in the country, right off I-65 in Hardin County. The project not only sets the bar globally for battery production, it breaks nearly all of our previous economic development records in Kentucky. This is the single largest capital investment ever made at nearly $6 billion. It's the largest single jobs announcement in our history with an estimated 5,000 new jobs, and they are good wage jobs. And with this announcement, we shatter every record that we have for annual economic investment. It's only September. This project is going to be located at the Glendale mega site. The twin plants will produce 86 gigawatt hours, making them what I believe to be the largest battery plants in the country. These enormous plants will capture the attention of the entire world. So this week, everything for us, Kentuckians, has changed. We became an undisputed national leader in advanced auto manufacturing, and we're establishing a new automotive ecosystem right here in Kentucky. All eyes are on us. All eyes are on Kentucky, and we're just getting started. I want to once again say thank you to Secretary Larry Hayes, the team at the Cabinet for Economic Development, and oh my goodness, everybody in Hardin County. Such a hardworking group, from the mayor to the county judge, to members of the Industrial Foundation, the local economic development team. Thank you for your tremendous work. And a special thank you to members of the Kentucky legislature for passing a necessary bill during a special session, doing it immediately, bipartisan, in a way that showed we can get things done. They deserve a lot of credit for helping us to land this. This announcement is planetary in size. It's going to create its own gravity, attracting so many suppliers right here in the Commonwealth. Think about this. There is no supply chain in the United States for an electric vehicle battery plant, meaning we're going to create all of it. And we're going to have the biggest production units right here in Kentucky. So this is just a start. When you think about what Ford does already, 13,000 employees in 2 Louisville facilities, but that generates almost 120,000 jobs with suppliers and distributors and the rest. This may have even more potential than that. Ford is now putting the Commonwealth front and center in advanced automotive manufacturing nationally, and we are committed to leading this country in battery production. Now we're starting to work on these projects that are transforming our future and our economy. We will never be a flyover state again, and nobody will ever be able to look down their nose at us ever again. We are excited about our future. From App Harvest with the future of agriculture in Eastern Kentucky to Pratt Paper with the future, cleanest, greenest, most sophisticated recycled paper mill in the country being built in the West, and now being a national, if not a global leader in electric batteries. Man, Kentucky is poised to take off. We're there. So everybody, this is an exciting time. It's up to us to make sure that we keep it going. And today, we got a lot of announcements about how we are keeping it going. You know, this would be a banner week. This is the biggest week ever without other announcements, but we don't stop because every region deserves prosperity, and we are seeing jobs in more places, and we have more interest than ever before. So first, Community Wellness Technology is locating a new facility in Danville. It is a $15 million investment, but get this, it's going to create 445 new jobs. These are quality jobs at an average hourly rate of $35.83, including benefits. Community Wellness develops comprehensive and fully integrated remote patient monitoring and clinical health coaching at a time when remote telehealth services have never been more crucial. So we've been talking about all of these incredible opportunities, how they're on the cutting edge of technology. This is another example in healthcare. The company was established about 2 years ago, and they quickly reacted in response to the COVID pandemic to develop technology to allow patients with a wide range of medical needs receive quality care while limiting the need for in-person hospital visits. It's an example of a company that took action, that innovated, that took initiative, and they're growing rapidly as a result. Community Wellness is going to be a great fit for Boyle County. I'm proud to welcome them to the Commonwealth. Thank you for being a part of our evolution, if not revolution, that is occurring right now in our economy. In addition, we have great news from Harbor Steel and Supply Corporation, which today announced its second facility and first in Bowling Green. Harbor distributes and manufactures a range of fabricated steel and aluminum products, and this project will create 20 full-time jobs with an $8 million investment. Again, quality jobs for residents with an average wage of $30 an hour, including benefits. Harbor's operated in Kentucky for the past 30 years, currently employing about 60 people in its Lexington facility. So when you think about a business that size, this is a big expansion that we should be excited about. The new 50,000 square foot Bowling Green operation will support overflow from the existing facility while allowing the company to grow its customer base and its service area. Work on the project will begin this coming spring, with the facility expected to be fully operational by the third quarter of 2022. It is great to see companies continue to grow in our state. I want to thank the leaders at Harbor Steel for this commitment to the Commonwealth. As we mentioned on Tuesday, part of creating jobs is about having the infrastructure to support them. And that infrastructure, especially water and sewer, creates its own full-time jobs while also providing for the potential for more. Now, this is one of the reasons that bipartisan agreement on our Better Kentucky plan was so important. Investing in water, sewer, broadband, and schools. It's going to create 14,500 new jobs. And today's announcement is above and beyond that. So today I'm excited to award Shelby County an $850,500 community development block grant. Funding will support the construction of approximately 2,300 linear feet of 12-inch gravity sewer line and manholes. These upgrades will serve Shelby County's industrial area, which supports one of our great new Team Kentucky partners, Velan North America, who just a few months ago announced its plans first to locate its North American headquarters in Louisville, and then open the copper and copper alloy recycling facility in Shelby County that today's project is going to support. These infrastructure upgrades will provide quality service that will better support Veland and its $100 million investment in Shelby County, creating 43 good jobs. So congratulations to Shelby County and Veland on today's award. Project exemplifies how collaboration between local and state government and the private sector can create opportunities that generate economic growth and good jobs for our families. Also, just want to say to Shelby County and the city of Shelbyville, done a really incredible job at working together. Was able to be the very first Better Kentucky water and sewer project that we announced several months ago. It's a type of collaboration and coordination where they don't let politics get in the way and work directly with us and others. It's a real credit to that leadership and that community. This week, we also shared some great news about expanding healthcare services in Louisville. Baptist Health, which has been a fantastic partner to Team Kentucky throughout this pandemic, has officially broken ground on a major outpatient medical center known as Baptist Health Breckenridge. The facility is going to include 5 medical office buildings on the corner of Breckenridge Lane and I-264, which is formerly occupied by the Breckenridge Inn. Facility will house physician practices, an ambulatory surgery center, urgent care, physical and occupational therapy, imaging, laboratory services, and a retail pharmacy. When complete, Baptist Health Breckenridge will serve as a patient-centered one-stop shop for primary care and more, with 144 treatment spaces for more than 50 providers. Healthcare is a basic human right, and access is critical in every neighborhood across Kentucky. This facility is an important milestone for Baptist Health and for all the families it'll serve from Louisville and the surrounding region. So congratulations to Baptist Health CEO Jer Coleman, Baptist Health Louisville President Larry Gray, my buddy Dr. Jody Prather, and the entire Baptist team for this great announcement. It is a lot going on. And we know when we have this much economic activity, more than we have ever seen in our lifetimes, we got to support the people that make it happen and the families out there, which naturally brings us to the next topic, which is driver's licensing regional offices. So the COVID-19 pandemic brought its share of tragedy and disruption to Kentuckians. From its first appearance, we had to really change the way we do things, to think about what people really need to do in person and how we can help them remotely. In keeping with our Healthy at Work guidance in the summer of 2020, our Transportation Cabinet Secretary, Jim Gray, signed an emergency order temporarily authorizing circuit clerk office staff to process expiring driving credentials, renewals, and replacement requests submitted through mail or at drop boxes. These used to have to be done in person. This temporary measure ensured cardholding Kentuckians with expired or soon-to-be expired credentials could maintain a valid license while not having to come in. And the program lapsed in June. But if we fast forward to today, the Transportation Cabinet's in the process of assuming all drivers' licensing responsibilities in Kentucky and making drivers' licensing regional offices the new home for licensing issuance by the end of next June. The state's going to do all of them by the end of next June. So today, we're announcing that by the end of October, more than half of Kentucky counties will have made the transfer from visiting clerk offices to visiting our regional offices. The transfer of services is part of the next level licensing commitment to usher into Kentucky a new era of licensing with more modern services and options that put Kentucky in the driver's seat. Case in point, in June, Transportation Cabinet launched the state's first online driver's license renewal service. In other words, didn't have to come in, could do it online. Since then, more than 30,000 Kentuckians have skipped a trip to the regional office and have renewed their license on their own time. I'm pleased to announce we're expanding our remote renewal options. Starting tomorrow, the mail-in renewal program will resume statewide, allowing citizens through the Kentucky Transportation Cabinet to re-up their driver's license without having to make that trip in. It's a revamped version of the former temporary mail-in program. And so with KYTC at the helm, Kentuckians will have new service options online through the mail or if you want, in person to get that license renewed. Simply, you'll be able to replace a lost or stolen credential without having to come in, especially if there are no address changes. Upgraded program does more than just give citizens flexibility. It's another way to deliver critical contactless service to reduce the spread of illness. But folks, it's also the future. And in many ways, that's what COVID has done. These companies investing big have seen their future and are stepping into it. And we've got to do the same in the way we provide services to Kentuckians. So this is a good example of what we ought to be doing. That, moving from the local circuit clerks to regional offices could be a pain. It could be. But now you can do it either online, through the mail, or when you need to head into that regional office. But when so many businesses are able to provide online services to you, the state should do its best to do as well. So a lot of incredibly exciting news this week. Let's move to our COVID portion of the report. Again, it's always a hard transition because we're living these two moments at the same time, one of difficulty and darkness, and one of hope, opportunity, a new dawn, a better day than we've ever seen, a better future for our kids. But we do have to get through this pandemic to get there. We'll start with today, 63 of our 96 hospitals are reporting critical staffing shortages. But the positive is we have seen hospitalizations decrease and now ICU utilization decrease over the past 7 days on our rolling average. 131 adult ICU beds available as of today. Pediatric patients, kids in the hospital, down in today's report to about 11 that are confirmed. But remember, these are in the pediatric units. There are really only 2. And so, we can't assume that we have a firm count of the number of kids that are in regional hospitals being taken care of. But we like seeing that down from where it was. Let's show the line graph on the inpatient census for Kentucky hospitals. This is now enough of a trend to say we are in a decline, and we hope it continues for people hospitalized because of COVID. We saw that. We were excited about it, but it needed to take time. And I will say Florida had at least one moment where they bumped back up in the course of what they've been through. So this is more people getting vaccinated. This is more people wearing their masks. Keep it up. Remember, that line is still way too high. If we went back a month and a half, where we are right now would rightfully scare the heck out of us. So let's make sure that decline continues. This next one is some relief. Again, we got to keep it up. ICU now appears to be going down. We read that as well. We kind of believed it was in a plateau, and we'll have to see if we get a jump from it. But what we really want to see is that line to look like the inpatient census, because we've had to create so many ICU beds in Kentucky that never existed before. We need to get those back to be in surgery centers. We need to get those back to their original function. And something that we hadn't seen until recently are ventilators. Also now appearing to be on a decline. Again, those 3 graphs, if you look at where we are now, or even if that trajectory continues 2 weeks from now, it's still so much higher than anywhere we had ever been. It's still so dangerous. So while this is generally good news, let's remember it still means a lot of people are dying. And we had 82 deaths reported yesterday, 82. A large portion of them were people under 60. But this thing is deadlier than ever. If you are unvaccinated, it is incredibly deadly. And it's taken so many people. Please don't make it take a family member before you're willing to get vaccinated. Because if you're willing to get vaccinated, it is still incredible protection against illness, against hospitalization, and against death. And I don't have it with me today, but the new report on the number of people that have long haul symptoms. Again, it's not okay to get COVID because you might not die. COVID can have long-term implications on your health. It can ravage your lungs. It can lead to a buzzing in your ears that can, really impact some people. It can have so many different implications, some of which we don't know. And if we look at the vaccination status of COVID-19 cases, hospitalization, and deaths, we continue to see that unvaccinated individuals make up more than 92% of those that are hospitalized. And this number is actually getting better for the vaccinated and getting worse for the unvaccinated, creeping up a little bit there. So please get vaccinated. And when you look at deaths here, both Dr. Stack and I believe that the boosters, and especially for the immunocompromised, are going to significantly help the fully vaccinated not suffer some of the outcomes that we're seeing here. We believe generally that this is a reflection of what this virus comes for. Those that are suffering from conditions, but the vaccines are so great that the opportunity through the booster to provide that extra level of protection is there. And let's remember, it's killing younger and younger people. The age distribution for COVID-19 deaths certainly are plus 70, which is one of our best vaccinated crowds. I mean, cut almost in half. But then those populations that aren't vaccinated at that same rate, especially 50 to 69, but then 30 to 49, significantly more, one twice, one 5 times as deadly as before. All right, next we have Dr. Stack here. He is going to give us an update on monoclonal antibody therapy treatments and whatever else Dr. Stack wants to talk to us about.
Thank you very much, Governor. Thanks for the confidence for carte blanche. I won't talk about sports or other things here today. So, James, if we could put up the slide deck. So I'll start with the monoclonal antibodies. So just to kind of a summary of this, for folks who become infected, the monoclonal antibodies can help give your immune system a boost, essentially by giving you laboratory created antibodies that try to counteract the COVID virus. They're effective. They probably are 75 to 80+% effective in helping to reduce your likelihood of hospitalizations. And so for those individuals who are at high risk for a bad outcome from COVID-19 disease, getting monoclonal antibodies is a good thing. It could help keep you out of the hospital and, of course, help hopefully keep you from dying from the disease. The antibodies became so popular, though, with the surge of the Delta virus, the Delta variant, that they were harder to come by. And so the federal government on September 13th had to change the way they were distributing the antibodies. And instead of allowing hospitals and clinics and others to order them directly, now the states are given a certain amount of antibody and we have to determine who receives them within the state. That, coupled with the recent legislative special session, have caused us to adjust the program that we already had in place. So first of all, to put things in context, close to 140 unique sites had already been ordering antibodies and distributing them or administering them in some form or fashion across the Commonwealth. The healthcare community in Kentucky really rose to the challenge and did a great job. So thank you very much to those sites that had already stepped in to get done what needed to get done. And we were actively working with them and supporting them with information, education, and helping them when problems arose with receiving their supplies. When we changed to this new model, we were able to change really within hours to start getting orders processed and cleared up. There was about a 1.5 week long backlog. We got that caught up and cleaned up, and then we started processing usually within hours of getting our new weekly allocations at the beginning of the week. We have all of our orders entered in the computer and processed, and then just the distributor has to ship them. For the overall program, as I just described, we get a weekly allocation. Health and Human Services for the federal government determines how much we get. It goes up and down, but right now it went down this week from the previous week. We got about 6,900 doses last week, about 6,100 doses this week. They determine the weekly allocation based on a number of variables. One, we have to utilize 70% or more of the antibodies were shipped, or else any state that uses less than that is at risk for having a reduction the following week. And that's done to make sure that the antibodies are going places where the demand is most and they're getting into patients as quickly as possible. The other two criteria are the number of new cases that the state has in the previous week, and then also the number of new hospitalizations that the state has. They use a formula for that and then determine how much we get. So to put in context, this current week with 6,100 doses, about 200,000 doses were shipped or allocated across the entire nation for that week. We got 6,100, and our population is about 1.3% of the United States population. So we got about 3% of the antibodies. We got about 1.3% of the people. So because the disease is so common here right now, we got more antibodies than our population alone would have garnered us. Now that will hopefully change, because if the disease goes down, we'll get less antibodies, and some other state who has a more pressing need will get their increased share. The sites now submit to a form, an online form. We receive those requests by usually before the weekend, and we process them on Monday. If we could have the next slide, please. Based on the available inventory, we fulfill as fully as possible every request. Now, the last 2 weeks, we have not been able to meet 100% of the requested doses, but we've been able to come close. There's two different antibody treatments out there right now. There's Regeneron or REGEN-COV, and then there's also another one that the chemical names are shortened to BAM-ETE for that combination of two different monoclonals. And we get that in a ratio. I think 30% of our supply was BAM-ETE and the other 70% was REGEN-COV. And we distribute those across the state. If you go to get antibody treatments, take whichever one they have. The FDA has approved them both for the treatment of the Delta variant and says that they're still both very effective. So go ahead and take whichever one you're offered. We are now going to have, as of this afternoon, a new website. You can go to kycovid19.ky.gov. There will be a new website this afternoon that'll show up probably with the normal update of the website about 4:45. On this website, we will show locations, and I'll get to that in just a second. Before I talk about the sites, please remember, I just told you that these supplies are limited, that there's not enough for the entire nation, and so that's why there's this new allocation system. So when you contact the site, they're going to use the current Food and Drug Administration criteria for who are the highest risk and the most in need, and they're going to use that coupled with their supply to determine a prioritization and who can get the treatment at that time. Obviously, the hope is the disease will go down, we'll need less of this, and everybody who needs it will have access. That's the hope. At the moment, that's not the reality, but hopefully we're not that far off. If I can have the next slide, please. So this is a map of where the pins are across the state. The legislative session gave us direction to make sure there was at least one in each of the 15 area development districts. And for folks not familiar with that, that's just a regional map of the state that's used for a lot of other purposes to determine various different planning and activities. Every site has at least one. Most have more than one. There are about 51 sites that should be on the map when we go live today. There are about another 45 to 50 additional sites who aren't on the map but who have received antibodies. As supply allows and as their interest matches, we will include other sites as well. The goal is to have the network as successful and as large as we can so that people can have access to the antibody treatments when and where they need to, and hopefully in a manner that is relatively convenient. If I could have the last slide, please. And this is just to show you over the course of our entire use of these antibodies, at least back to July, the orange line is the number of doses or number of people treated in the previous week. The blue line is our supply, the amount of inventory we have on hand. You can see how the two lines almost touched each other the week ending September 21st. That's when our supplies started to get constrained and the demand surged. We are now being told by some of the administration sites that their new bookings are slowing down, that the number of people seeking treatment is declining. And I'll use this just to give the other category the governor mentioned. This is good. The test positivity rate's going down. The number of new cases is going down. The number of new hospitalizations is going down. And now we're more recently seeing that ICU admissions and ventilator usage is going down. All of those are pointing in the right direction. And so it's reasonable to see that the demand for these antibody treatments is also going down. So knock on wood, folks, hopefully October is much, much better than September. Please, if you know someone who works in a hospital, thank them. They've been through a lot. They're going through a lot right now. The levels are still way too high to celebrate. It's difficult for the healthcare workers, but it's also obviously difficult for the patients who are very sick in the hospital. But hopefully October will look much, much better. And as I wind up here, I just want to remind you, the vaccines prevent almost all of this. And so if you have the opportunity to get vaccinated and have not already, please do. The vaccine is abundant. You can easily go into a pharmacy and probably even walk in and get an appointment within minutes and get a shot. So please get vaccinated. It's what will keep you and your loved ones safe and help us put all of this behind us as quickly as possible. Governor, thank you.
Thank you. All right, so take just a minute to talk about messaging and communications on COVID. This administration has been and will continue to be committed to getting the right COVID-19 vaccine message to the right people at the right time to save as many lives as we can. Since March of 2020, when the first COVID case was reported, it was March 6th, we've relied on every possible way to get information to Kentuckians. We've collaborated with hundreds of partners to raise awareness, educate Kentuckians about how to prevent the spread of infection, and to protect themselves, their families, their communities, and to provide facts about these vaccines when they became available. We've relied on everything from hundreds of news conferences to TV and radio to social media to billboards to virtual meetings to help get out important information. To ensure confidence in the safety and effectiveness of vaccines, we partnered with local health departments, healthcare experts, vaccine providers, community leaders, pastors, coaches, athletes, artists, teachers, young Kentuckians, and influencers, and others, virtually anybody who was willing to help to encourage preventing the spread of infection and, when it became available, to get vaccinated. We made the commitment to reach hard to reach Kentuckians too. Any disparities in getting a vaccine to everyone who wants one are unacceptable, and we continue to work to address this with targeted messaging and special events such as vaccine events set up in communities all over Kentucky. Our goal has been for every Kentuckian to know where they can go for reliable, updated, factual information. In the earliest days of the pandemic, instructions were to visit kycovid19.ky.gov. Site has detailed information about how the virus is spread, how to avoid spreading it, and remember, we were constantly updating it as we built out the testing program, as we learned more about the virus. Norton Healthcare provided a hotline for Kentuckians to use to get questions answered. Remember, we used to talk about the number of calls going there, and indeed had to split it off, I think, from the poison control hotline. It was getting so many calls. Our local health departments, healthcare experts, and community partners were critical to help getting out this information too. Starting in December 2020, we began a partnership with a Kentucky-based advertising agency to help get the word out about the vaccine. We believe it's been effective. Over 15 million digital impressions have been made on websites, on social media, and other electronic formats. Over 61 million print, radio, TV, cable, and out-of-home impressions. Out-of-home includes visible messages on billboards and bus wraps, and other out-of-door options have been made. If you've gotten important COVID-19 information from the radio, whether that was a station you've set your dial to for years or something newer like Pandora or Spotify, it was on account of this media effort. If you saw information posted on Facebook or Twitter or YouTube or Instagram by us, then you saw the fruits of this outreach. If you watched network news on cable TV, whether on your TV, computer, smartphone, or tablet, you saw COVID information. Again, an effort to get that word out through every partner, including the media. We've worked hard to make sure Kentuckians had answers to questions or knew where to go to help, for help, or knew who to go that maybe was that next person that they would trust. Whether it was requesting transportation to get a vaccine, we got that addressed. To arrange to host a vaccination event, we got that addressed. Or where to go to get a COVID test and more. We didn't and we will not stop. From October through January 2022, we will continue to offer help through media outreach, community partnerships, including with colleges and universities, and with the trusted voices of widely known Kentuckians and Kentuckians who are known and respected in their individual communities. Heading into this fall and winter, we're going to focus more closely on the folks who haven't yet gotten a vaccine. Media campaign will emphasize the safety and effectiveness of the vaccine, and it will encourage Kentuckians to talk with a healthcare provider about the vaccine. The media campaign is also going to include our voices, Kentucky voices, that have lost somebody and that wish that individual had gotten the vaccine. Often it's us talking about our most difficult moments that other people can relate to. And I want to say ahead of time, I appreciate the strength of everybody who's willing to share one of the most difficult moments that they have had so no one else has to go through it. And it's the grief, it's the raw emotion, but it's also that love of that individual going through that hard time doing this because they love everybody else that we think will and does make a real impression. We're also going to focus on the symptoms and effects of contracting the virus, honing in on symptoms, growing representation in our hospital for Kentuckians who are 40 or younger. Think about the groups that are getting COVID the most. We're going to talk about the cost of being hospitalized, often what, $23,000, $24,000, $25,000, even when you have health care coverage, versus the cost of the vaccine, which is free. We're also going to talk about long-term side effects, something that we've talked about, but needs to continue to get out there because we continue to hear from those that are impacted by misinformation that say, well, I probably won't die from this. Yeah, you probably won't die from a lot of things that you do lots to prevent yourself from being in that situation. Next phase will also raise awareness of individuals who need to get booster doses, that need to get both doses that may have only gotten one of Pfizer and Moderna, as well as when the time comes, kids ages 5 to 11, a time that I am thrilled to see coming very soon. We all want the same thing, to get back to normal, to not have our friends and our family members dying, to be able to go out to the biggest of events without a mask and get to enjoy each other. I mean, our economy is on fire. Our opportunity ahead of us is so incredible. We talked about it. We just had the single largest economic development announcement in our history. One of the largest companies in America, one of the most iconic companies, chose us for the future of their great company. I mean, our future has never been brighter, but we got to get there. We should want everybody to make it there with us. You know, normally when you're trying to navigate through a storm, you just want to make it and you just want to get everybody through it. This is more. We know what's on the other side of it. And it's one of the brightest, best days that we have ever seen. So enough is enough. I mean, as a Commonwealth, let's make sure we come together. Let's make sure we have those hard conversations with people we love. Let's get everybody vaccinated and then let's get done with this thing. Let's move on to those brighter days where we are going to be a national leader. So, final part today, vaccine update. Actually, between yesterday and today, 4,807 new Kentuckians vaccinated. We have a new county leading for vaccination. That's right here, Franklin County at 78%. But I know Woodford County is competitive, having previously led much of the time at 77%. And so I know that they will continue to push on. Fayette County, 74%. Campbell, 74. Boone, 72. We'll break out all the demographics next week, as we always do, but let's keep it up. Every day we have 4,000 plus people vaccinated is a day that we get closer to the end of this. All right, we'll open it up for questions. We have 2 journalists with us today, and then we have about 5 on the phone. So we'll start with Tom Latek from Kentucky Today.
Thank you, Governor. Dr. Stack is talking about the monoclonal antibodies, priorities of who's going to get them. Are those priorities the same as they were at the beginning of the vaccination season, so to speak?
All right, let's ask Dr. Stack to come back up. The question is on the priorities and what they include for folks that need monoclonal antibodies, since there are not going to be enough. And let me just say this, you cannot count on them to save your life if you are unvaccinated. I have a personal friend that we lost that was vaccinated, but still got this virus and got that monoclonal antibody treatment. I mean, nobody should want to be in that position. So please get vaccinated.
So thanks for the question, Tom. So the Food and Drug Administration gives criteria. So it's pretty much people who are at elevated risk for severe COVID disease. So the prioritization will be if you have no medical problems, you're very low priority. But if you have high blood pressure, heart disease, lung disease, there's a whole list of things, cancer, active treatment with medicine that weakens your immune system, all those things would qualify you. The things that are less likely, you could also theoretically use this for people who aren't sick but got exposed to the virus. That's called post-exposure prophylaxis. That's very clearly not a priority at the moment because so many people actually have the disease. If we get to a point where the antibody supply is quite sufficient for all the need, then anybody the FDA says is allowable will be eligible for it. So each site will have to apportion that based on their current supply and the demand coming to their site, following the FDA guidance.
Carolina?
On the decline, did we just naturally hit that peak, or is an increased amount of vaccinations driving that decline? Essentially, what is triggering this? And then also, I have another one today. It's for one of my colleagues back at the station. She just wants an unemployment update, essentially, the people that still haven't resolved issues, what's going on.
We'll get you an update on unemployment with the numbers. I don't have them in front of us today. Significant numbers of in-person or virtual appointments we can get you to. We believe that those have been really helpful. Our problem now isn't as much of processing how many real people there are out there, but getting to the real people as opposed to the fake and fraudulent claims. And so we're not looking for needles in a haystack, but we got a lot of fake claims that we've got to push through. And that also means when you look at our numbers, they're not all real people. And we got to get to each and every one of those individuals. Now, I think our filings for unemployment are slowing down, which is a good thing. On the decline, again, we hope it is a continued decline. And so a lot of this has assumptions, but the first part I think we're in a decline is while we weren't able to vaccinate enough people to stop the Delta variant entirely, we were able to vaccinate a lot of people. When we look at 60+% of all Kentuckians having gotten at least their first shot, 70% of all eligible Kentuckians, that means a whole lot of people out there were pretty protected even from this Delta variant. It then burned very, very quickly to everybody that is not vaccinated, with case numbers and exposure happening so rapidly. Some people have probably had it that never even knew that they had it. So I think we're very much in a modified Philadelphia, St. Louis versus Philadelphia. Our almost straight up and down that is Philadelphia, I think is primarily unvaccinated individuals, which means we had a smaller population that was most at risk, and it's torn through that population really quickly. That was good news for the vaccinated. It is pretty bad news for the unvaccinated. And what that means is if we're not going to reach herd immunity with the Delta variant, whatever's coming next, you really want to be vaccinated for. Stu Johnson, WEKU. Stu, we got Dr. Stack for you today.
Thank you, Governor. It might be for him. It's a masking question. In terms of if well vaccinated, what's the significance of proper masking now with this decline? I guess what role can proper masking play with this decline? And also, talked to a healthcare official this week that said the cloth masks are really not sufficient. So, what about that?
I'll start and then let Dr. Stack come in. Remember, there are breakthrough cases, and there are more breakthrough cases, that is vaccinated people getting the Delta variant, than we find out about, because a whole lot of people that have this vaccine suffer very little symptoms, but they can spread the virus, meaning you can spread it to somebody that is unvaccinated. These are proven in study after study after study, masks are, to decrease the spread. And remember, we're on a decline right now based on not just the virus, but our response to it, our vaccinations, where people are wearing masks. So we want to keep that moving forward. And I know Dr. Stack will talk about spread through both the air, but also through droplets. And there's no question that having something over your mouth stops at least some of what would spread this virus.
All right, thank you, Governor. Thank you, Stu. So first off, these masks are important as part of layered mitigation strategy. These are part of a comprehensive strategy. So none of us have ever said any form of mask is perfect. All right. So just to be clear, that being said, we have provided now reams and reams of studies, real world epidemiological studies where populations did or didn't use cloth or other non-surgical or non-N95 masks. They've used scientific studies to just look at the transmission of disease, of droplets and stuff, from how far they go from people. The masks work. They're not perfect, but they work really well. And when we all wear them, they really reduce the transmission of respiratory diseases, including COVID. So that's, I think, settled science now, and the rest is unfortunately distraction. As far as what about being vaccinated and wearing these? Before the Delta variant, if you look at the data, those vaccines were stopping COVID totally. People weren't getting sick with breakthrough infections. They weren't spreading it if they were vaccinated. The vaccines were a home run, a grand slam out of the park home run. They were phenomenal. Now they're awesome, but they're not a grand slam home run because Delta got wickedly worse and it spreads a lot more easily. And people appear to get, younger people even, a lot sicker, a lot more quickly. And now you see all these mortalities. And tragically, the youth, the younger population is the higher unvaccinated population, are the ones who are now unfortunately dying at an age when they should have never died from the disease. So masks are still essential. And I want to put this in context as my last point. Last year, this disease was so unknown, and had we let it run through the population with no vaccinations and without these other tools, these mortality figures, the projections that scared a lot of serious policymakers, we're seeing what could have happened. Delta went through so fast. That's the nightmare scenario from last year. Had Delta been here last year and we didn't do all those other steps, that's when we're announcing tens of thousands of deaths over less than a year. It's already tragic enough that it's getting closer to 9,000. But so we are now to the point where we are asking very few things. Get vaccinated. Please wear a mask whenever you're indoors around others. Just put this in context. We've come a long way from where we started. There's only a handful of things we really need you to keep doing right now. And if we get the rest of us vaccinated, hopefully even those things can start to become unnecessary. Thanks.
Sarah Ladd from the Courier-Journal.
Yeah, thank you. I wanted to ask a little bit about yesterday's death total, the 82, which was pretty high. Can you kind of break that down for us a little bit? Was that in part or entirely because of how high cases and hospitalizations have been, or did that include a backlog? Just trying to get at why it was so high. Thank you.
Well, so first of all, we get the information in from the local health departments. I can't tell you that one or the other may have saved 2 days, worth of information before they submit it, but all of them were from the last 2 months. All of them were for August and September. None of them were from a backlog where we audited and went back. This is all real death from the Delta variant. And I think what we're seeing is, remember, death trails cases, that we have cases, we see the hospitalizations, and then the death comes, at the end of a hospitalization, but the report takes a little more time. So it's always at least a couple weeks or maybe even a little more before we see the tragic consequences of what we're living through in the moment. No, this is all, almost every death that we have announced during the Delta variant has been from this period. And it shows you how quickly it kills people too. I mean, as opposed to the other where some people held on for weeks and then made it. and sadly some didn't. This is one where people come into the hospital and 3 days later, they're not with us anymore. So we think that we will see more. We do. When we look at the number of cases that we have had, and we hope we've peaked, but if we just peaked, we're still going to be seeing the deaths associated with that peak. And then until the decline is down a significant place, we're going to see more from there. And again, it's why we got to get vaccinated. We got more cases even now of the deadliest part of COVID that we've seen. So it's all really recent too, and it's really tragic. Josh James, WKY.
Hi, Governor. Switching gears, lawmakers this week discussed rescinding the state's $15 million investment in Brady Now Unity Aluminum Mill. What is your thinking on that issue, and is it time to try to get that money back?
Well, even as Attorney General, I was very concerned with this investment. First time we ever wrote a company a straight up check. And then after the last administration wrote the straight up check, they separately entered another agreement where they let go of all the security interests that we had of how we could try to get that back. And that wasn't taken before the legislature. So here you have a state investing in something that was virtually a startup, no other operations anywhere. And then, I don't know how you can justify it, relieving the company of that legal obligation or whatever that security interest was that we could get back. I'm concerned whether we can get the land back that they're on, even if they don't begin to operate. And it's put us in the position where, if we had that security interest, we may have acted on it a long time ago. But it's put us in the position of not having much of a choice in the initial run to trying to see if they can succeed. But I think that there needs to be a deep dive in how the policymakers inside the last administration are somehow the presidents or senior executives of the company, that they encouraged the direct investment in and then let them out of the obligations. No one would do business that way. No one's attorneys would ever advise them to do business that way. I've been very concerned about it for a while. I will continue if we think that there is any opportunity there to support it. But I understand every lawmaker who is concerned. I understand exactly where they're coming from, and I'm happy to talk with any and all of them. I believe we're all on the same page, and what I'd talk with them about is what options we really have versus what we don't. James Pilcher from WKRC.
Good afternoon, Governor. Want to ask about a different, a more agricultural issue. You have been vocal about your opposition to the increase in excise taxes on tobacco, given its impact on the state. What is the potential impact to the state, and why are you opposed to that tax hike?
So, first of all, I'm against smoking. I hope that one day everyone will quit smoking. I've lost people that I know and care about to lung cancer. But what the current bill in Washington, I won't say moving through Washington, and we'll see, does is the portion that impacts the tobacco industry, which means the farmers in our state, is so disproportionate in how high the increases are compared to anything else. It's going to cause significant, severe, and very quick job loss in Kentucky. And there is a very specific portion of that market that primarily goes into snuff that is grown almost exclusively in Kentucky and ultimately processed in a plant in Hopkinsville. And while the increase in the federal cigarette tax is big, the specific increase to this one sub part of the market that only is in Kentucky is enormous, and inexplicable. And so we believe it's unfair, and we have raised that. Again, we want to make sure everybody stops smoking, though we know that folks will ultimately make their own decisions. But we just believe there needs to be a level of fairness and in different types of increases, and not one that targets Kentucky almost solely or alone. Melissa Patrick, Kentucky Health News.
Hi, Governor. So my question was about the healthcare workforce shortage and your request for a plan from the General Assembly. And during this press conference, a letter popped up on email from President of the Senate, Robert Stivers, to you. His laying out a plan. Seeing that letter, and if you have any response to it, basically lays out 3 different options for money.
I just got the letter today. I think I was pretty clear that if we're going to call a special session, they need to come meet with me. And I got a letter. Also, no indication that there have been any discussions whatsoever with the House. Again, the serious work that's required for a special session doesn't appear to have really been started in earnest, much less done, and we need to see a lot more. Also, have been having specific conversations with different hospital organizations out there, and as of yet, not convinced that this would solve the problem as opposed to escalate the arms race with these different private nursing and other services. Listen, this administration has done as much for hospital systems as I think any you'll ever see. We showed the other day we're over $1 billion of additional payments than hospital systems ever saw before. National Guard, we got a really nice message today about how great they've been. Nursing students, and I think that's actually going to pay dividends going forward, taking over testing, AmeriCorps students and others. So we will continue to work directly with hospitals, to have our direct calls with them. But there's policy making and there's politics in Frankfort. I've shown that I can sit down and work with anyone, and I'm willing to, but they have to be willing to sit down too. I'm still told that the written plan is the bill that was previously filed. Again, that doesn't show where the money is coming from, which is really, really important. All right, that is today's Team Kentucky update. Listen, we got to defeat this virus. This has been a heck of a week for the Commonwealth of Kentucky. Our future is entirely changed. It is here right now. More opportunities for my kids and for yours than ever before, I think, in the history of our state. Let's not fumble this opportunity. Let's get everybody vaccinated, and then let's drive our electric truck into our future. Thanks.